Hi, I'm Dr. Jack West, and I'm an associate clinical professor in medical oncology at the City of Hope Comprehensive Cancer Center in the Los Angeles area. I'd like to talk about immunotherapy for advanced non-small cell lung cancer and why it is important for patients to discuss goals and treatment options with their healthcare providers. This is a setting when it is an ideal moment for shared decision-making. And I'm going to talk more about this concept of what shared decision-making means, but it is especially important when there are actually many comparable choices available to a patient, and the differences between option A and B or C is really based on the combination of anticipated benefits and risks. And it requires a patient to make a judgment about which issues they prioritize more or less. So there isn't going to be a one-size-fits-all best approach for a doctor to recommend for every patient, but rather the best approach is going to be different from one patient to another. Now, the concept of shared decision-making is really an evolution of the latest integration of patient information and patient involvement that really comes a long way from the origins of medical decision-making, which for centuries was paternalistic. The concept was that the clinician had information that the patient didn't have about the anticipated benefits and risks, the adverse events or side effects, and then use this information to tell a patient what to do. And it was expected that the patient would accept that recommendation and pursue it. This evolved to informed medical decision-making, in which the clinician still shared that information with the patient, but the patient was understanding the concept ideally and would make an informed decision to follow that path. But it was really clearly, here's what you should do. Does that sound reasonable to you? Yes, great, let's move on. Shared decision-making is a newer concept that involves bi-directional feedback. In other words, a dialogue between the clinician and a patient. And the clinician shares their perspective of the various options, the pros and the cons, the anticipated utility, the efficacy, and the side effects, as well as other factors. And the patient brings in their own personal perspective of how much they're concerned about side effects, how aggressive they want to be, concerns about the time commitment of being in an infusion center more or perhaps less, the recovery time perhaps, travel requirements, and also the expense of treatment, which is increasingly a very important issue when we're talking about cancer therapies that can be quite expensive. It is important to also factor in that shared decision-making is not always appropriate in every medical situation. It requires several conditions to be met. One is that there needs to be more than one reasonable option. If there is clearly one best approach, and there's nothing else really to talk about, then the goal is to have a clinician convey why that approach should be followed and hope to have the patient come to the same conclusion that this is absolutely the right approach and anything else just doesn't make sense. The patient also has to be willing and able to participate in that decision. So shared decision-making may not apply to somebody who has just had a stroke and does not have the capacity to weigh decisions. Importantly as well, there needs to be enough time to have this kind of dialogue. And most discussions, most ideas in cancer care are not so emergent that they won't allow for this give and take discussion. On the other hand, if you're in an ER and there's a trauma or someone has just had a life-threatening heart attack, there isn't really necessarily time to have a careful discussion of the various options, and a clinician is going to need to make a move. But in the setting of lung cancer or many other cancers, there is enough opportunity for patients who are motivated and can participate to carefully consider the various options available to them all in the light of day. Why do we care about doing this? Well, besides the satisfying concept that it is a patient and in patient-centered care, they should have the opportunity to really participate. There's practical reason for shared decision-making. Patients whose providers listen to them, who elicit goals and concerns and explain the range of options, are 3 to 5 times more satisfied with their providers than those who are not given these opportunities. So in a world where there are options also available in terms of where patients get their care, it makes good sense to educate patients and involve them in their own care decisions. There are other resources for patients on immunotherapy and shared decision-making in lung cancer treatment. And I'm listing here several web addresses, URLs, that provide various resources in the form of a PDF document that can be read, a video, and a tool specifically for patients to participate. So I would encourage patients to learn more about this and to learn by doing, to engage their physicians, their medical team, and be part of the decisions that affect their care in a setting where there are many reasonable options to consider.